Hello, this is the weekly review program of Sawa Sawa Network, making sense of relevant topics and news. My name is Roger Alfred Yoron Mudi. I'm the producer and the host. Today, joining us is Dr. Richard Lako, chairman of the COVID-19 Audit Committee, constituted by the South Sudan National Taskforce on Coronavirus Pandemic about 2 weeks ago. In his statement to the general public announcing the establishment of the COVID-19 Audit Committee, South Sudan Vice President and Chairman of the National Task Force on COVID-19 Pandemic, Hussein Abdulbagi Akol, stated that most institutions in the country, public and private, no longer adhere with COVID-19 safety measures, no hand washing facilities or sanitizers. The public no longer wear face masks and no social distancing among the issues he mentioned. Abdulbagi said the COVID-19 Audit Committee is constituted mainly to increase public awareness about the second wave of COVID-19 resurgence and to prepare citizens to accept and integrate COVID-19 precautionary measures into their lives, among other reasons. The scope of work of the Audit Committee, the Vice President stated, include to develop risk mitigation metrics, to assess safety and compliance at places of work and social gathering, check mortality surveillance records to identify deaths due to COVID-19, and to present assessment reports and recommendations to the National Task Force every Wednesday. Welcome, Dr. Laku, to the program. And let's start with the Audit Committee's work. How is it going so far? Give us a highlight of what the committee has done and observed while carrying its duties.
Well, first of all, I would like to take this opportunity to thank you, Alfred, and Sawa for the opportunity. And regarding the work of the Audit Committee, indeed, we have started immediately after, we commenced immediately after the Vice President assigned us to start doing work. Of course, as you said rightly in that communique, we had come out with a checklist which mainly in 5 main thematic areas. One area, COVID-19 spread. One is about the healthy environment where the institution is. So we looked at the environment of the institution. Is it healthy enough for them to operate? And this has about 6 marks. And we had also the operational environment, which has about 8 marks. And we have the toilet, which is the 4th thematic areas, and sanitation. It has about 6 marks. And lastly, we had the mitigating measures that could contribute to curve down the second wave, and this has 4 marks. So this is 33. So in doing so, we visited the offices and we have made observations. And when they score 30 out of 33, we have realized that there is some observations. We have not seen posters in the office, and some offices are actually crowded, and we advise them to improve in certain aspects that we have observed. And I think that was the first place we visited. Then we moved to Minister of Health, and Minister of Health also we have checked, and we had rated Minister of Health at 28 marks out of 33. And they are also at lower risk. However, there were some observations that also we made in terms of proper water system, and also looking at the issues of wearing masks. And some people were seen not wearing masks. They entered the ministry, but they decided to put the mask out, and also lack of some of the sanitizers in certain places. So we had made general observation and make recommendation for them as well, hoping that. And in all these 2 offices, we told them we'll have a surprise visit that to follow up on this and ensure that people are improved. After that, we also managed to visit Juba University. And Juba University, they were rated at 27 out of 33. And we also made some observations. Students, some of them within the compound are not wearing masks, and they are resisting when they are told. There is issues of sanitation and water supply, especially with the toilets. And some of the offices also are congested, and also issues of the sanitizers in some of the offices. So we We also talked with them and gave them recommendation which they are working on, and they also informed that there will be a surprise visit follow-up on these measures. We also visited one of the private facility, that was the Royal Palace Hotel.
Yes.
It is the hotel, Royal Palace Hotel.
Okay.
Is the facility is for accommodation and catering. They accommodate people and also they do catering. So we went there, and as you know, that hotel also lost their manager. The manager died with COVID. So we're also advised to go and see whether the environment are actually good or not. So we assess them, they observe, they get 25 out of 33. And also we have made some observation in issues of the wearing masks. People are allowed to come in without masks. In the restaurant, you'll find that there is no social distancing, and also the environment outside, especially where people in the evening go and sit around the swimming pool, the environment actually is not conducive and it doesn't promote sitting. So we also advise them accordingly and told them that they will be also visited later to check on those things, whether they are improved. We also went and checked the Juba mortuary facility, because it report comes that the mortuary is full and there is community happening, and we actually found that the capacity of the mortuary is small. It takes about 36 bodies at a go. And with the increased mortality that are happening in community, it become impossible for them to cope. We realized that Juba mortuary is more or less working with less than half capacity, because the other places of the mortuary and the containers are not actually working. The freezers are not working because of the gases. So we also had the challenges from them in terms of human resource, in terms of transport, in terms of personal protected equipments that are required for them to protect themselves, which we also raise it to the National Taskforce, and we are now working to address them to make sure that they go back to their work and look at the expansion possibility of expanding that mortuary to handle any number of cases. So this is last week. And we also,
the airport, right?
In the closure of the week, we visited one of the funeral place. No, that was last week. This week is, I will come to it. And then we also visited one of the funeral places, one of the Major General, as a brother who died. And we also made an inspection. We see whether people actually that came there in small, close family members, and they are actually social distancing because they are receiving the body and they take it for burial. We made some observations and we advised them, and they say they got approval from National Task Force, but we later confirmed that it wasn't true. They didn't get an approval. But lastly, this week we visited Juba City Council, and in Juba City Council we also read Juba City Council at 27. And they have also some observation that they made. We issues the office congested, issues of sanitizers in office, and then social distancing and lack of hand washing facilities at the toilets. So we make a couple of observations that we make recommendation along and tell them that okay, they have to work on it and we'll have a follow-up visit. We also went to custom and we made observations. The Munuki block were there because these belong to them, and we made some observation. Most of the people in the market are not wearing masks. Everybody moving, and there's no social distancing. The buses are full capacity. They don't go half capacity. So we made an observation and discussed with City Council, and we planned for a meeting, a special meeting with the City Council and also the Association of the Transport and the public health officers of Juba City Council, in looking at how do we make sure that these regulations are actually put in practice in a better way with their involvement and agreement as well. So these are kind of things that we had. When also we ended up visiting the airport, and also airport, we have observed the issue of social distancing is not there, wearing masks is not there. The VIP, they don't respect the rule, people goes. So these are also observations that are met, and we had met a recommendation, and in yesterday task force meeting, we have given a comprehensive report with recommendations that the task force appreciated, and they felt these are a very good step, and they encourage us to continue doing work. But the resolutions, the recommendations that we made actually would be coming as a part of the communique and resolution assessing some of these issues.
And with regards to the total in general, how would you rate the situation? Because you have given us specifics, the areas you visited, but in total, in terms of compliance, what would you say in terms of compliance generally?
No, in total, there is no compliance at all. People, even those who claim to be wearing, they put masks, but they don't wear it in a proper way. Because when we talk of wearing masks, you should not put it at the chin and you claim to be wearing it. You are equally the same as somebody who has not wear mask. The public themselves, they complain. I've received some calls. People are telling me now the buses are full when we go, and I've been asking, why do you go to bus when you see it's full? And this is your right as individual, as a citizen. You should not allow the driver to take more people. If you're insisting, you people get out of the bus, because responsibility of us is yours. So compliance are not there. And also when you looked in the market and also in the public places, still the compliance are not to the level that we are expecting. And that's why we still see an increment in the number of cases. The graph is going up, and unless we intensify those measures and make sure that people comply, we will not be able to bring that curve soon down.
And the recommendations you shared with the National Taskforce Committee, could you share with us some of them that, of course, going to come out from the National Taskforce, but as the Audit Committee, what have you recommended so far, briefly?
Yeah, we recommended, of course, the issue of the enforcement, and with the enforcement, we were tasked also to do something further, which we'll be working on today, to come with some defined penalties with regard to defiance. Those who defy, doesn't want to observe at the individual level, at the institution level. That will be communicated, and then it will come as a part of the resolution that will go out, so that the law enforcement will use it to address. This is one thing. The issue of the VIP, we asked the vice also to take it to the high level, because we will not be able to approach the political leadership, but that could be addressed in different level. And he took it upon himself in ensuring that he will be doing that communique. And the issue of the transport and the issue of the market, we already recommended that City Council is now has agreed, first of all, to have a meeting with the transport, because the transport people were complaining that one of the reasons they go full capacity, because they will not be able to go half capacity. They will be losing because the fuel has increased. And Juba City Council has come with a new tariff that they discussed with them that could be introduced, that will not also affect the public. But we, at our level, we need to make sure that what is it that they do with these people in terms of the regulations and all this. We've agreed for a meeting, and we recommended that we'll have a meeting with the city councils and all the quarter councils as well to discuss further some of these issues. And the security enforcement agents are actually urged to immediately start, especially the issue of the gathering, funerals, and parties and all this, and the nightclubs are also directed to really start closing down some of these functions, because this is where major transmission of the disease is happening.
With regards to those closing up of like nightclubs and these places for parties and so on, some people make their money through that. And this lockdown, if other people are able to observe those measures like social distancing and sanitizing and all this, why not those measures also incorporated in those activities, like those nightclubs, and also some of the you see suspension of like even government. I've seen that in one of the directives they said even the Council of Ministers will only sit on extraordinary sittings, so there are no regular sittings. If this
Yes.
some other activities are able to be done through social distancing and having people sanitize and all this, why not people adopt those measures and then everything continue with those measures?
The problem is, of course, like we say, burial, for example, is something that you cannot avoid. If somebody dies, he must be buried. But we say the burial should be done under certain regulations, very minimum close number of people, using wearing masks, and make sure that they are not actually touching each other, and there's social distancing. And this has to be actually observed. But when you come to the actual implementation of this, the people will not do that. Instead of a small number, you'll find that they were crowding. They wanted to fall on the body. And coming together and touching each other. If I'm asymptomatic, but I'm carrying the virus, I already give it to you, and you take it. You go back home, and then you start infecting the relative of the form. This one is also taken, and this is how the infection. So the pubs and the discourse also the same. People will get excited after drinking and all this dancing. They hug each other. This is where the transmission happens, and you cannot control. So the best is during this kind of period, and that's why we came with the partial lockdown. The partial lockdown idea is to ensure that temporarily we try to control things and make sure that we bring the curve down. And when we study the situation, if the thing is going down, there is no major spread, then we'll try to release things slowly until people go back normal to their life. But if you leave things like that, it will continue rise, and it will continue rise, and now there is new variants that are appearing. South Africa has reported new variant, UK has reported new variant, America has reported theirs. So sooner or later, now even us will be also reporting different, that the other one that is start circulating inside the country and causing us more problems.
As clearly stated during the formation of the audit committee, one of the aims of the committee is to prepare, the objective to prepare citizens to accept and integrate COVID-19 precautionary measures into their lives. And so far, are the people cooperative? What are their reactions? Are they getting along well with you in convincing them to incorporate those, to accept those precautionary measures, or people are not giving you even attention, the public?
Yeah, we are seeing to some extent. And we are realizing, we are also observing that most of the people are aware about the measures and they know the risk, but there is some few things that still we need to work on. Number one is the element of stigmatization. Stigma is a big thing that in community. And that's why in most cases, people want to go hiding. Even if I know I'm positive, I don't want to disclose myself, because otherwise people will now stigmatize me. And it is like something that is a shame and what. So this is one bigger problem. The second thing, and this goes with the denial as well. Some people, they deny that they don't have, even if they have, until when they are reaching the 0 hour, this is where they accept. And that's why you see there is a lot of deaths that are happening in community. The other one is, and the last, which is more important, we realize that we have given people enough information. They know the risk, they know all this, but they have not owned the problem yet. They have not owned this as a problem, that me as an individual, this is a problem. If I don't take care of my health, it will be a danger to me and to my family. And I must do something. That thing is not happening much, because we felt we need to go another step further, but engaging the local community, especially the chiefs, and then going as far as the quarter councils, give them the responsibility so that they engage the heads of the households and make sure that they take it from there. Because by engaging at that level, the issue of the cleanliness, the issue of sanitation and all this will contribute into a bigger picture that we've been doing. And when they own it, then that will become a real easy way of controlling this out.
What about on the issue of vaccines? What is the view of the audit committee? There have been talks, people have been suggesting even that despite the number.
Of course, as you're aware, we have done all the process for the vaccines. We have submitted the request, and asked us to submit what we call it vaccine deployment plan, which we did. We have been notified that we'll be receiving 20% of the total population of South Sudan. That is 2.4 million doses, and these doses will come in shift. 3% of this, which is about 800, more than 850,000 cases, doses, will be coming toward the end of this month or early next month. And then the 17% will be dispersed in the first quarter of, and the second quarter of this year.
Some people have been suggesting that the government should look forward to purchasing. I saw in one of the forums of this task force, the Citizens Task Force on COVID-19, people have been suggesting to get as much as 8 to 10 million doses of vaccines. Is that you see them possible, or these are things should be looked forward into?
It wasn't possible. Not possible for us at the moment, because first of all, these vaccines are not actually available yet in the market. By the way, even the 20% that we are asking, this after they have made sure that they gave, because there is 96 countries that Gambia has donated vaccine to, and they are giving them 20%. So they are first to make sure that they deliver this 20%. If they make sure that all these 96 countries has this quota, now if vaccines are approved now to go into the market, then this is why you buy. But at the moment, these vaccines are not for sale. It is only been supplied, and it was supplied under emergency list of utilization. That means it still have some part of the clinical trial that has not been fully authorized that can go to market and sell by everybody. That's why they are asking countries, when they're giving you this vaccine, you need to sign what we call it indemnity. Indemnity means you know that these vaccines is not 100%. The safety and the effectiveness are known, but still people does not know more about it, and people need to study until we have more information that will provide this in the market. So because of this, all the countries has to do that as a requirement. Otherwise, they will not give you the vaccine. And this is why all of us are doing it, to ensure that we have those things done, and then we have the vaccines, the first shot, and then we'll see if we manage to get the 20%. By then, if the government have resources and there are things in the market, then we can see in future whether we buy more or not.
And on the lockdown, actually, it was declared the partial lockdown subject to review in a month time, which actually a few days left. What is the stance of the committee, the audit committee? Are you looking forward to having the lockdown extended, the partial lockdown extended, or to be ceased?
It is a possibility. We are also looking at the data, because one of the things regarding is whether the curve is going down or not. The reason we put this lockdown for 1 month, because we've seen that incremental increase in number of cases and death as well. You can see in February alone, we used to have about 60 deaths. In February, February alone, we have additional 30 deaths that happened so far. This 30 deaths is almost 50% of the deaths that we have since last year, April until January. So you can see that more than 50% we just have in 1 month, and we had more than 60% increment in cases compared to what has happened in the previous 9 or 8 months that has passed. So that incremental rise in cases and deaths subjected us to quickly get some measures so that we'll be able to control, and that's why. And now we're looking at the data, and we're examining the data, the deaths day by day, week by week, and trying to see. Now we analyze, and this will inform us. But extending the lockdown is also a possibility. When we're still seeing these 4 weeks, things are going up, we'll recommend accordingly. But it's a possibility that could be.
Now, as we head towards the end of the program, what would you say is the challenges facing your committee, the audit committee, that should be addressed or need to be addressed so that you can deliver as required effectively?
Yeah, the challenges that we've been facing is still the cooperation of the institutions, particularly the private. I think this is why we're still getting challenges. When we are going there, we told them we are just going to inspect and try to also advise and make sure that if things are not moving well, we work with you so that we address them and we contribute into it. So that's one of the bigger challenges. Cooperation is one of the problems, and also some of the resistance. When you see in some institution we recommend, we see some resistance. And of course, the issue of resources are required for us to, so that we'll be able to move fast, we'll be able to engage. This is also another problem that we are looking. But all in all, is something that we have committed ourselves and would like to work with everybody and the public to ensure that we really try to curb down this outbreak.
Well, finally, what can you say to South Sudanese in general, the government included, and the private sector as your final message?
Well, I would like to tell first, I would like to say that COVID is real and we are still in the middle of the second wave. We have not reached the peak and we are seeing increment. For the last, as I've said, I've given you the data, we have seen every week where the number of cases is doubling, the number of deaths are doubling. This means the outbreak is serious, there is serious transmission happening in community. So abiding by the COVID-19 measures is something crucial and important. So responsibility of health is started by individual. Everybody must do his part to ensure that he protects himself, because if he protects himself, he will be able to protect his family. When his family is protected, he will be able to protect the community, and community can protect the village and so forth, and we'll be able to protect ourselves as a country. That's number one. Number two is the protection itself, the things that we're talking about. Wearing masks is key. This is one of the best weapons that we have that can help us reduce this. So we want to see everybody wear masks in public places when we are leaving your house. The issue of the social distancing and avoiding gatherings is also critical. We wanted to see that people abide with this, at least during this partial lockdown, to ensure that we contribute into that. We wanted to tell the private sector, because now most of the private sector, this is why we are seeing a lot of problems, like even including the hospitals that we are seeing, because they are not observing the real infection prevention control and protective measures that we are telling we are doing. So we want them also to abide with this. It is not about Ministry of Health. It is not about Ministry or Task Force. It is about us as a part of the community of South Sudan, and it's about South Sudan as a country. So everybody has a role, and we really need to see that. We also wanted the private sector to come forward and provide resources. Now people are looking only at the government. The private sector, they also had a role, corporate responsibility that they need to do to ensure that we together work and make sure that we bring this outbreak under control. And for the government, of course, we would like to say we really need to get the support of the law enforcement agent, but also want to see that more resources are being put forward so that we'll be able to do more testing, more screening, and we'll be able also to improve the case management, and we'll be able to 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 raise awareness and provide personal protective equipment to our frontline workers so that we'll be able to make sure that they do their work without fear and without hesitancy.
Well, Dr. Richard Lako, Chairman of the COVID-19 Audit Committee constituted by the South Sudan National Taskforce on Coronavirus Pandemic, thank you very much for being on the program.
Thank you very much.
And to you, our viewer, we've come to the end of the program. This is the weekly review, and I'm Roger Alfred, the producer and the host. See you next week.